and today I introduce you to a future where everyone wins. Direct contracting with imaging, with medications, with docs, with labs, all of it. You can direct contract with every player in that ecosystem. It makes the employer the hero, and now the employee is the alpha consumer, and the doctors are now happy, prosperous, and gets back to the well care, not the sick care model, gets away from factory medicine back to true care, and no more machinery feeling like you're a piece of meat if you're a patient, a doctor, or an employer.
At Health Rosetta, we empower humane, community-owned health plans with high-quality, trustworthy, local, affordable care from caregivers we know and trust. We free up compassionate, well-trained, community-based caregivers to rediscover their love of medicine so that they can do what they've always been called to do: serve their patients, not just in disease, but toward their fullest health. Health makes it possible. Health professionals are incredibly compassionate people who are well-trained and crave the freedom to love their patients back to health. Just like patients, they want to see and be seen, hear and be heard, and just like patients, they want to feel and be felt.
For the middle class. No country has smarter or more compassionate nurses and doctors or more innovators who've reinvented this country time and again. In all corners of healthcare, there are people who went into it for all the right reasons.
These aligned professionals keep their patients out of harm's way and take time to discuss care options, answer questions, and address concerns. E-patients are smart, but frustrated that they can't be healthier. In many ways, our modern society is stacked against them and their health. We must create an ecosystem of health built around connection and intimacy for all stakeholders, from the patient to the caregiver to the local environment. We need humane health plans designed to keep individuals well, taking as few drugs and having the least number of medical procedures possible. And we need environments and people who support the patient on a regular day-to-day basis, not just during visits. We know that many times the best place for connection between the healthcare provider and an individual isn't at the clinic.
When you have a sick child, you don't want to go sit in an urgent care clinic for an hour and a half with people coughing everywhere. When you can get on the Spruce app, virtual, you can go into the brick and mortar, it costs you $0. If your child has to get an x-ray, you're immediately referred to the local imaging clinic that we have direct agreements with. It's a $35 x-ray instead of a $350 x-ray. And you don't have to pay for that. The member has zero out-of-pocket costs. It's a very gratifying experience. Number one, to be able to save the client a ton of money, but number two, bring the healthcare experience back to the consumer.
Avoiding waste means at least $1 trillion can be reinvested in proven outcomes that actually drive health.
Healthcare's hyperinflation has been devastating promoters of health, like education, safe neighborhoods, access to good food, clean air, and clean water. But if you provide free lifestyle and medication management, it's better for the employee's health and their bottom line. If every employer did that in this country and had that will and common sense, it would be like a citizen-driven $500 billion economic stimulus every year into the economy.
Healthcare is local. It's about you and your family, your employees, and your neighbors. When we focus on individuals who make up the community, everyone thrives.
Healthcare is a very local phenomenon. Trying to solve healthcare at a national level is practically impossible because what works in Denver is not necessarily what works in Topeka. And what we really have found is that the more you localize healthcare and the more you understand the impact to that family and what are the decision points and what are the different options and the cultural perspectives, the better you really get in terms of health outcomes and the quality of life for the people in our communities.
This community-wide transformation is dramatically accelerated through openness between all stakeholders. including the sharing of ideas and transparent data flow. Humane health plans expect and demand full transparency from all providers of care, billing, and administrative services. A trusted and sacred caregiver-patient bond is built through transparency and openness that equips and empowers patients wherever they can best achieve their unique health goals, at home or in any setting, best optimizing their well-being.
If a health plan could be a person, it would be a great mother. If you think about a great mother, hopefully a great father, that's kind of where health starts. They keep you healthy. When you're sick, they help nurse you back to health. When you're thinking about doing something maybe seems like a great idea, but probably isn't, they kind of keep you out of harm's way. That's what a health plan ought to be.
Healthcare is already fixed. We just need to replicate the fixes. It's possible, and it starts here, now, with you.